So, dear guests, good morning. Welcome. There are still many seats available in the front. So, for all of you just arriving now, don't be shy. You have a lot of seats available in the front here to be a bit closer to action. I would like to give you a warm welcome to all of you to this first live policy debate of our journal, International Development Policy. My name is Gilles Carbonnier. I'm professor here at the Graduate Institute, and I'm editor-in-chief of the journal International Development Policy. This event today is co-organized by our journal together with the Center for Education and Research in Humanitarian Action, the CERAH of Geneva. So welcome to the students of CERAH, who have some of them have joined us as well. And it's my pleasure actually to open this session entitled Haiti, What Lessons Learned 4 years down the road. And indeed, the question is, with hindsight, what can we learn from some of the failure of the aid system in Haiti, and how can we do things better, in particular looking today at what's going on in the Philippines. But just before that, let me say that the policy debates that we have now opened as also live debates have been born last year, because last year we decided to launch a new version of our journal. It's an e-journal in electronic format. And this has allowed us actually to open a new section beyond the traditional academic peer-reviewed articles. We have opened a section called Policy Debates, where we invite policymakers, practitioners, as well as scholars and researchers to first contribute one controversial or at least provocative piece on a hot topic in global development. And then we invite other stakeholders. So if the controversial piece has been written by a practitioner, we would invite scholars, people from academia, to react to that. And then we open a blog where other people, any people interested, can actually contribute. So you can see on that we have a whole range of, the website of the blog where you can contribute to the ongoing debate on Haiti, plus Twitter, Facebook, etc. And if you want to tweet or write anything on this event now, you have the login and the password, which is there for you. So I think that this is the new era of e-journals, and this session is also video streamed. So let me turn to the policy debate of today. We have this first policy debate on Haiti. We have other policy debates that are going on now on commodity trading and the role of Switzerland, on, for instance, the role of international actors in promoting democratization in Central Asia, or in the protection of civilians in Sri Lanka, or the lack thereof, actually. Today, we will hear first, we have three panelists. We will first hear Mr. Jean-Marc Biquet, based on his initial paper entitled Haiti Between Emergency and Reconstruction, an Inadequate Response. You'll find the original paper that Jean-Marc Biquet has written actually in French on our website under the title Haïti, entre urgence et reconstruction, une réponse insatisfaisante. Jean-Marc Biquet, who sits just on my left, is research officer at Doctors Without Borders, MSF Switzerland, and is also a lecturer and researcher at CERAH. We will then hear the reactions and comments of Ms. Andrea Binder, who is just left of Jean-Marc Biquet, based on a written reaction entitled, Is the humanitarian failure in Haiti a system failure? Andrea Binder is Associate Director of the Global Public Policy Institute in Berlin, the GPPI. Thank you for coming all the way for the event. And when we talk about lessons learned, as I mentioned, of course, we have in mind the ongoing response in the Philippines following Typhoon Hainan that hit the Philippines last November. And this is why we have invited a third panelist to also comment on the topic and react. This is Miss Elyse Mosquini. Welcome. And Miss Elyse Mosquini is a Senior Disaster Law Officer at the International Federation of Red Cross and Red Crescent Societies. I asked all the three panelists to be very short, to limit their intervention to 10 minutes maximum, so that we have at least half an hour for an open discussion with the audience, with you. And after that, for those who can stay for a while, there are a number of sandwiches in our cafeteria, so the discussion can continue for a short while in an informal manner for those of you who want to join us in the cafeteria, thanks to the generous support of the Swiss Development and Cooperation Agency. So without further ado, Jean-Marc, you have the floor.
Thank you. So good morning, everybody. I wrote an article 2 years after the earthquake as, in fact, somewhere an outcry of my frustration to see that the Haitian population was totally displeased with the aid. Okay. My contribution was written 2 years after the earthquake as the result of a frustration to see the Haitian population totally discontent with the way the aid was organized, the reconstruction was going on in the country. And with quite a lot of empathy, I had to admit that we also, as being part of Médecins Sans Frontières, we were quite displeased with the way the aid was organized. The earthquake happened in January 2010. It had a major impact. Something like 46,000 to 200,000 people died in a minute. The figures are differing from sources to sources. More than 300,000 people were wounded. 1.2 million people were homeless and lost all their roofs. The problem with Haiti was also the fact that the hidden area were the center, the economic center, the administrative center, disrupting all what was eventually organized at that time. The hospitals paid a heavy price. 60% of the hospitals of the affected region were destroyed or severely damaged. This created a massive influx of assistance, a real solidarity organized by all aid actors or supported by private donors. $3 billion were given for aid actors on the ground by private donors. 5.3 billion were given by states. And even a bit later, 11 billion were promised for the reconstruction of Haiti. So there was an intense mobilization and quite successful to provide the response to the basic needs of the population. But quickly, we saw a shift in the discourse and the attention of the international community and the aid organization towards reconstruction. Mr. Bill Clinton, who was the representative of the General Secretary of the United Nations, spoke about Haiti. This earthquake is an opportunity. It's an occasion to rebuild Haiti better than it has ever been. Build back better was the mantra, which was spread all over the media in Haiti as in the rest of the world, to say that we will take that opportunity to build Haiti that will be pleasant for all its citizens. The time was passing, and this discourse was becoming the mantra used by everybody, while the Haitian population was still the feet in the mud, still having eventually the basic needs covered, but not seeing anything in terms of reconstruction. And with the months passing, the frustration and the anger of the population was definitely visible, and we can perceive it because there was aid organization receiving stones when the car were passing in the streets. Haitians saw a massive discrepancy between what was the discourse, the promises, and what was the reality. They spoke in Haiti of the NGO Republic because they see NGO members, the ones who are trying to assist in the ground, being responsible of those false promises and their reality, which is not necessarily very improving. Today, there are still something like 200,000 people who are homeless, so living under tents that were given 4 years ago. Those are figures from OCHA. The aid organization tried to coordinate themselves. There was thousands of NGOs pouring in the health cluster, which is the coordination mechanism for all the actors working in health. There were more than 600 representatives, 600 organizations doing or pretending to do health services for the population. The system of coordination is meant to not only prepare the next disasters, but to make sure that the present needs are addressed by the existent actors on the ground. And also there were mapping organized stating that this organization is in charge of that health in that region, those organizations are working in another side of the country. It presented quite a good picture of what was feasible in order to pretend at least that the aid community was prepared for the next problem and able to assist the population. 10 months after the earthquake, cholera epidemic started in the country, a context that didn't know the disease anymore for more than 100 years. That disease was spreading quite rapidly in the country, affecting a lot of people. In 3 months, there were 200,000 patients who suffered from cholera. What was the reaction from the aid sector? It was to call for money. Although there were reports that were explaining that all the money received for the earthquake was not yet spent, up to 30% of the money raised at that occasion was spent. Where the rest of the money is, that's a good question that the Haitian at least was asking themselves. In terms of reaction, in 3 months, for the people affected, only 2 actors were able to provide some treatment. So it was the Cuban brigades of doctors coming from Cuba, and MSF. Those 2 actors not being part of the coordination mechanism, thinking that eventually those coordinations are not necessarily very useful in those occasions. The immediate action was to provide assistance and treatment to react to an emergency. And when calling for other actors to act, notably to work in water and sanitation, which is one of the major activities that you have to implement to tackle a disease like cholera, there was nobody. So MSF was, in that time, the organization for which I am working, was not only obliged to provide treatment for a massive influx of patients, but had to divert a part of its energy towards water and sanitation in order to jugulate these epidemics. It took up to 3 months for major aid actors to develop their first cholera treatment centers. So from a coordination mechanism presenting an idea that we are prepared, we are preparing ourselves to respond to the next emergency when there is a real failure, and the burden was on their shoulder of only few actors who had the means, the capacity, and the willingness to act. It was not a question of money. Money was available, but not necessarily for epidemics response, but still about the reaction to the earthquake. So the flexibility was non-existent. Today, the situation is not that good in Haiti. Haiti has not started with the earthquake. Already the situation in Haiti was very bad before. In terms of access to healthcare, it was considered by WHO that only 60% of people could access geographically to health structure. MSF did surveys and explained that the financial barrier was such that 80% of the Haitian population could not afford to access to healthcare system. It is said now by observers that the situation of today, 2014, is back to what it was just before the earthquake. There are still 200,000 people homeless who were promised to have a better Haiti. The health policies are not yet clear. So hospitals that were built and managed by NGOs, foreign NGOs, like MSF, for instance, building a hospital for 5 years, transparently stating that we can provide that health structure for 5 years, and we are not there to remain forever. We still don't know who is going to take over. We still don't know where the new health structure will be built as soon as they will be built. So we are still in a total limbo concerning what will be the rehabilitation. The money is drying up, at least the money towards the NGOs. States are giving now money to the Haitian state, which is not a bad thing. We don't necessarily know where the money is used and how it is used, but at least the situation of today is definitely not acceptable after having made so many promises. We are used to have states pledging that amount of money, and then we see that they are not disbursing that amount of money. But the fact that aid actors themselves participate to that idea that we are going to build Haiti good for Haitian people, I think definitely we missed the point. We missed the point, and we made false promises that we are going to pay, that Haitians are paying definitely today, but that the aid system in general is paying also for the future.
Thank you, Jean-Marc. Andrea?
So, just as a quick background, I was asked to provide comments in form of a debate or reaction in form of a debate to Jean-Marc's piece. My background is that I participated in the cluster evaluation phase 2 in 2009-2010 that looked at the cluster system in different countries, and I was in Haiti in 2009, so before the earthquake, and then again for the real-time evaluation of the earthquake response 3 months after the earthquake. Ever since, I haven't been back to Haiti. It was a very conscious decision. We were asked to do many follow-up evaluations in Haiti, but we felt there are so many actors that we not necessarily have to add to the overcrowdedness in the country. But all the information that goes after the earthquake, and also particularly to the Philippines, is for me second-hand information. So I try to focus a little bit more on the earthquake response. And the second point is, as I said, I was asked to respond in a way to enhance the debate. So while there are very many points that I agree with Jean-Marc on, I picked those that I felt would probably be a bit provocative. So the first one, that actually comment that I make in my paper, is actually a positive observation of the argumentation, but that I felt is falling a little bit through the cracks. And this is the hypothesis that Jean-Marc makes about the success of a humanitarian intervention, and that this success is defined by both the capability and capacity of the humanitarian sector to react, and by its integrity to manage expectations of those who receive the aid. And I think the second part of this argument is very rarely made. And it's true. I mean, there's even if there's enough money, even if there's enough operational capability and capacity, it's a humanitarian response, and it's only very basic needs in the ideal case that can be met, and particularly in a very complex situation such as in Haiti, where, for example, government employees in Haiti told me they're not sure how much of the homeless people are homeless because of the earthquake, and how much are people who've been homeless before, but also see a chance in the response, obviously, to also get some sort of shelter. So it's very difficult to actually say what can we achieve. And that one response, instead of always striving to have more money, then we could help more, is also to say, well, we can only help to a certain degree, and to be honest about this. And that relates very much to the idea of whether we really want to promote slogans like Build Back Better, which are mainly, obviously, made for audiences in the West to generate more money and more goodwill to actually help. Whereas it's, I think, to most actors relatively obvious that with a humanitarian response, you can't change the political setup and the structural problems of a country like Haiti that keeps it in poverty. So I really found it very interesting to look at the second part of the equation, and to say the humanitarian community has also a responsibility to manage expectations and to be honest about what can be done. And then my second argument that I made in response to Jean-Marc's argument was that somewhere in the paper, Jean-Marc says the international system seems to be more the problem than the solution to the needs in Haiti after the earthquake. And a little polemically, maybe, I phrased this as system failure, and saying actually we have to question whether the case of Haiti can serve us as an example for system failure, so that the humanitarian system as such failed in Haiti. And I question this analysis for 3 reasons. First of all, like from a purely scientific perspective, it's one case. If you consider the cholera epidemic as a second emergency in Haiti, you could talk about 2 cases, but still happening in the same country. And it's very difficult from this case to judge on the entire system. And one reason why I felt that it's a bit of an unfair judgment is that when we did the cluster evaluation in 2009, 2010, looking in 6 different countries and very different emergencies, we actually found that the cluster system slightly outweighs the results of the cluster system. So the advantages of the system slightly outweighs its cost. And you can imagine that this evaluation was quite politically, so we negotiated this slightly for a long time, insisting on having it in the text. But I felt that if there's so much focus on the failure of the system, and also that we sort of adding many mistakes made to the system, we emphasize the urge to reform the reform. And that's actually what happened. So from the cluster reform, the humanitarian reform, we went into the transformative agenda, and it might only be partially a reform of the reform, but we're so much in the reform process all the time, because we focus so much on what's not working, that I asked myself whether we even allow for institutional change. It's obvious that it's very difficult to change an individual institution, but to change a system that's made up of very many institutions of very different mandates, very different types of actors in terms of how each individual organization is set up, but also how they act to each other. We should maybe allow for more time and be a little bit more calm about our self-criticism. And my third point that I made to steer a little bit of debate, and I actually had a long discussion with MSF in Germany afterwards on this, and that's less a critique of Jean-Marc's argument than of MSF, because I was saying, like, even though a lot of the criticism is obviously justified, like just standing there as MSF and pointing to the problems without actually coming forth with approaches on how we could do better, besides operational arguments, obviously. I felt that an organization that's had an annual budget of $1.3 billion, which makes MSF as big as the ICRC, so globally, as the ICRC and the American government's spending on humanitarian assistance, we could expect from MSF a bit more of a constructive critique and ideas on how to come forward. So essentially, it's a call for more leadership for MSF in my paper at the end.
Thanks. Good, thanks. Is this one working then? Yeah? Okay, good. All right. Thanks. So again, Elyse Mosquini, I do work for IFRC, and I work for a particular program in IFRC called the Disaster Law Program. So my presentation takes a bit of a legal institutional look at the operation in Haiti. And as I was asked to look specifically at lessons learned that we can draw, I look first at Jean-Marc's paper, and then kind of use as my launching point Andrea's points about how scientifically what lessons you can draw from one example in Haiti and then other examples. So, I mean, really starting out, I mean, reading Jean-Marc's paper, of course, you note there are some very real and correct gaps and issues identified there. It's hard to argue that there were some serious shortcomings, especially in the cholera response. Things didn't go as well as they could have, or especially even should have, we can say. But at the same time, I don't think that this adds up to a whole systemic failure, as Andrea says, and I think that part of the reason for that, actually, and this sort of leap that we make from reading Jean-Marc's paper to potentially drawing that conclusion, is at the very end of your paper, Jean-Marc, you mentioned that we shouldn't, well, in your words, but in mine, delude ourselves by by overestimating the significance of the impact on the government, how the government was so hampered by the earthquake itself in terms of the individual personnel, the state infrastructure, their resources to respond, that we shouldn't extrapolate that into such a largely significant impact on the whole operation, whereas I think actually that in fact is the key to understanding the difference between the Haiti response and other responses and what lessons we should draw for the whole system actually. Partially, that is certainly because I am a lawyer and I do look at institutions and structures, but I think this really makes a critical difference for several reasons. One is that if you look at the current institutional coordination structure, the international system currently, right, based on the Humanitarian Reform, looking at the cluster systems being perhaps the sort of landmark piece of that, is that the cluster system is designed under the assumption that you have a state with its own coordination structures and domestic response capacity, and that the international system comes in and complements that. It works with it. And a lot of the reform process I see over the past years has been how to make sure that those two, the domestic system and the international system, really do work together. And a lot has been written and said about this, and you have whole processes like the Disaster Response Dialogue Initiative that tries to see how, in fact, we can make those mesh and work better together. Now, the thing that happened in Haiti is that critical assumption that you have a strong, well-functioning, competent state with resources to dedicate wasn't there. And so, from that perspective, the operation in Haiti broke down to some extent, but not because of the international system necessarily failing in a general sense, but because it didn't align with the national system. So I think just a couple of examples as to, in a more detailed way, how that worked is, if you look at, for example, the arrival of international actors, and we know, that there was this huge influx of international actors, right? Some reports are in the hundreds, some go into 1,000 or more. Now, the reason there are so many reports, in fact, is that no one knows how many people were there because these actors weren't registering. Now, this is despite the fact that Haitian law required that NGOs would register on entry to the country. They're not legally operating unless they do. The Haitian government recognized the issue that there were lots of actors coming in. They looked at their procedures for registration with their limited resources that they had and said, okay, we need to create an expedited process. The normal process is 6 months. If we make some changes here and in an emergency, put in some new procedures, then maybe we can get control of this. The problem was, even with that measure, the NGOs still weren't registering. I think the records that we have are something like maybe 10 NGOs actually registered officially with the Haitian government after the earthquake. There were a couple hundred that were already present in Haiti and were already registered, but so few, you see. And I think that it's concerning on a couple of levels. It's concerning, of course, that the Haitian government didn't have the resources to enforce its own law, and it's very sad. But what's even more sad than that is that the international actors coming in didn't respect the authority of the Haitian government enough to respect their law and to follow it. So that's one thing. I think also in the arrival of humanitarian goods, Haiti is not an exception in this case, that you often see after a large disaster with lots of media attention that a lot of goods are sent in, sometimes goods that are not needed, that are unsolicited, certainly on a list of items that the government has asked for aren't necessarily appropriate for the circumstances. And this, of course, is very practically complicated, but legally it's an issue as well, because normally, again, the government of the country who's admitting these goods would have laws and procedures about how to admit and process these goods. The Haitian government, again, of course, did. They also, in this case, put into place some measures to expedite the clearance of relief goods. But in this case, it was, in some sense, even messier, because the step that they took for the first 6 weeks or so after the disaster was to essentially just open the gates and let everything in with essentially no checks. Customs declarations were made orally and goods were cleared. Then when they did put into place some emergency measures that would go on for 3 months, the same measures were then again put in place for the cholera disaster. Then they tried to regularize the goods that were already put in place. So even with this expediting measure, there was a backlog still to clear, and it led to huge bottlenecks again. So if you see this sort of interaction issue, I think this is the biggest problem that we're seeing. to understand what a critical difference it makes then, whether a state is prepared or not, if you look then at the Philippines case in Haiyan or in recent disasters, other ones in the Philippines as a government has invested incredible resources over the last years in improving its own preparedness and its capacities for response. I mean, one thing they've done is they've completely overhauled their whole Disaster Management Act and included, a look as to how they institutionally are arranged to handle a response, and they've considered how they would handle international actors coming in. Right after the Haiyan typhoon, they put in place measures, guidelines to relax visa requirements. They put in the one-stop shop for customs goods and customs clearances for relief items, and they were, in fact, on top of it, if you will, right? They were able to put in place these measures and then to see that they were enforced. Of course, there are always some things that come in, some people that come in that they don't have control of, but it was managed in a more understood way. In the more recent reviews that you see of Haiyan, there was just an ISC operational peer review that was published. I think the release was a few days ago, but the report was a few weeks old now. And the reviews are actually quite positive. I mean, almost to the extent of glowing. The wording is around the real partnership between the government and the international actors coming in. We know that in the Philippines, for example, they have institutionalized the cluster mechanism in the country, right? They have governmental authorities who are in charge of running the clusters who then co-lead it after a disaster. And so you really see the international actors side by side working in partnership. And I think this is really the critical difference that we see. And I think it's important to think about disasters in the future, whatever country they might be in. What I would say from this perspective is, you can look at three different ways of approaching it, right? What do you do then if the state hasn't built up the capacity, if they're not prepared? You can look to the international system to how it can tinker with its own structures to better respond and assist that state. You can imagine that the cluster system, even though it doesn't have the authority to do so, could use its influence and power to better control actors, to see that unqualified actors aren't coming in or practicing medicine without licenses, things like this. You could imagine that you would look to the international actors themselves institutionally to, with all of the initiatives around professionalization, quality and accountability, and raising standards, things like the Foreign Medical Teams Working Group, looking at improving medical standards for international doctors coming in, things of this nature. Or we can really just seriously invest as the international community in helping the state build its capacity, whether it's immediately in the first days and weeks after disaster, to hold their hand and bring them up to really maintain control, or in the longer term preparedness. Thanks.
Thank you very much. Thank you very much to you all three panelists. You have all stick to the 10 minutes talk, so we'll have ample time for discussion. I would like to open this discussion just by one remark. Maybe some of you here in the room might question why there is no one coming from the UN. You will, just if you read the editor note presenting this policy debate on Haiti, you will see that we have been in contact for 2 years with several agencies in Geneva, in New York, etc. But for some
evaluations, and I'm ready to believe that very probably MSF and whoever did, of course, not 100% to understand our colleague from IOM, but maybe what you meant was 90% or 80%, or let's say no programming. How do we address the question of system failure? Where are the responsibilities? Because again, bouncing back on what you very rightly say about Haiti, we all know it. Nobody engaged in Haiti at the moment without knowing that this was a failed state, no governance, nobody paying taxes. Come on, anybody in this room apart from the students, but anybody else, we knew it from top to bottom. So, how do we address this? How do we address this? And I will tell you, I'm very preoccupied as president of Voice in this. Again, Voice is an association of 83 NGOs, all the big NGOs apart from MSF. MSF is very special after all. You are, with great respect. The question is, this is going to blow in our face. It is my conviction. And this is where it's dramatic. Because as the gentleman from IOM said, it's not true that everything went wrong. But if we don't address it, we are losing the confidence of the citizens. And they are putting the blame where it shouldn't be. But I think it is the NGO world which is receiving the flack. And if we don't address this issue, the sympathy and the credibility of the sector is going to be very badly damaged. And so we are going to suffer, of course, as a sector, but ultimately it's not us who are going to suffer the most. So I will...
To my mind, this narrative about Haiti as a failed state is at the very core of the problem why the international actors, and particularly NGOs, overran whatever there was as a state. So I think as a humanitarian community, if we're serious about wanting to engage with the state, we probably have, and the students here might be better placed than many of the professionals, a more differentiated view of what the state is. The state is not only the national administration in the like in the capital city that was, of course, severely hit by the earthquake. But when we were there were still structures remaining on the municipal level, in the outside the capital city. Then of course you had the communities. We went to Ravine Patate. It's like an informal neighborhood of Port-au-Prince, if you want. So there were people who could organize and collected sex and age disaggregated data. I'm sure they've never heard about this before, but they simply collected like how many women and girls and boys and men, what they needed, how they were affected. It was on paper, it was there, but there was no way for the international community to actually engage with these, to know where to go. It was just like for us by incident, because we went into these quartiers chauds where most NGOs even didn't go because they felt it to be too dangerous, that there are local structures, whether you call it the state or whether you call it the civil society or whatever Western label we have for this. But if you really actively look for a way you can tap into local structures, then there is something. And I do think that if we have too much a narrative about it's a failed state, it's all bad, no one has even like, a walkie-talkie to communicate with, and that's why we have to do it. It's like at the core of the problem. The second point that I wanted to make, or like in reaction to what I heard, is the question of whether it's a failure or not. And obviously, no one's actually like if you look at individual projects or individual actions, of course, there are people who are proud and can be proud of what they did in Haiti. But if you look at like the response as such, I don't think that even I would argue it's not been a failure. Of course, I mean there were so many things that went wrong that everything else would be weird to say. But I'm also like in a new position now to defend the cluster system. I don't think that the cluster system, and that's what I meant with like a systemic failure, has necessarily been a failure. I'm not saying it's been great, but there's been an overwhelming number of actors that at least have been bogged down in cluster meetings, while other more capable operational actors could actually do the work. And it sounds a bit cynic, but the cluster has never been invented to regulate the number of NGOs who are coming in. The NGOs themselves didn't register, as we heard. There was no mechanism whatsoever. So at least you had a forum where people could talk and exchange what's the very, very minimum standards, or what's the thing you absolutely shouldn't do. And there's a long list of things 3 months after the earthquake that would have been really problematic if people would have implemented them. And so there was a certain quality management system by the cluster system. So the question is, what would have happened without it? So it definitely didn't operate the way that we would wanted the cluster system to operate, but I do think it actually spared us some more harm to do. And also, if you look at the CERAH response from Turkey these days, the NGOs that are not registered with the Turkish government and their coordination performance, you look at the cluster system a little bit different, maybe. There was like one third point that I wanted to make, and maybe I leave it to you, Jean-Marc, but my understanding about this response of MSF and the Cuban brigades was that actually the cluster, the health cluster at the time of the cholera outbreak, when the first 3 cases or so were found in Artibonite, decided to have, as a learning from the earthquake response, a more capacity building approach and helping the Ministry of Health in Haiti to come up with a response and so on. Whereas MSF and Cuban brigade said, no, we stay out of it. It's like an epidemic disease. You have to react to the very first cases. You can't wait until some capacities build up. So we really see this sort of conflict that's there between quick response in cases where it's really needed and in other cases where it might not be needed. And staying outside of this cluster strategy made MSF and the Cuban brigades to be earlier in responding to the cholera than other organizations, but that's just, as I know, the chronology.
Jean-Marc, Biquet.
Just on that point, when the cholera epidemic started, the Haitian Ministry of Health took its responsibility by saying we are going to manage it, like we would expect in any countries of the world. They discarded the health cluster to provide a response because they were not believing in its capacity. And they went towards MSF and the Cuban brigade and say, go on, we need you to work. So I would say from the Haitian authorities, they did what they thought was the most appropriate. MSF is part of the health sector, in the aid sector. So when there is a criticism given towards the AIDS industry, we are part of it. We have to take it on board also and reflect about our own weaknesses and eventually potentials. In this case, the AIDS system, I never used this expression, the AIDS system has failed. Yes, there was definitely a massive discrepancy between what the AIDS sector promised to bring to the Asian people and what was really put in place by the aid sector. So it's our own fault as aid actors to promise things that we cannot implement ourselves. We have to come back to the humility to recognize what we're capable to do, what is in our hands, what is in our capacities. That's probably what is definitely lacking today. By creating coordination mechanism, which is a necessity, mainly when there are so many actors who are arriving in a hotspot where there are plenty of humanitarian needs, there is a necessity of coordination, but it doesn't have to be a catalog of goodwill, trying to map what is potentially said to be available and capable to do. There must be a capacity to determine what is ready to be done, to be implemented in case of needs. And that's where there is a weakness in the present system, where we just try to put on a list who is ready to do what, even not assessing the capacity, the real capacity of those actors to implement that assistance. MSF has no recipe for the future. We are part of that sector. We are trying to be operational because we are meant to be operational, and we have to coordinate with other actors, spreading the information about what we intend to do, what our capacities are. We don't have a recipe, so we will have to participate in one way or another to finding the most appropriate strategies for the future. But we must be very humble in what we are capable to do because we are an operational organization, and eventually not to pretend that we are going to build back Haiti better because the reality proves that it's out of the scope of what NGOs can do. And if we realize it in advance, then eventually we will change our discourse and we'll be totally humble in our speeches and promises we can do to our beneficiaries, which are the ones suffering of what we pretend to do. The aid sector, if they lose the capacity to have a good reputation, that's nothing. The people who are on the ground, who are having needs, they listen to us, they see us, and they're the ones who are judging and have all the capacity to see if we are good or bad.
Okay, I'm sure that, like me, many of you have taken a number of take-home and food for further thought. I have two among many, but two I want to mention. First is the question of whether the aid system has failed or not. The point that is clear is that the aid system can improve and must improve. And the issue that was raised is a question is, should we move ahead with a reform of the latest reform? before even envisaging having this reform coming to fruition or not. This is a big debate. And another point which was quite important and I think came up very clearly is the question of state weakness or state fragility and the necessity of, for aid organizations to start working in so-called hybrid political orders without waiting for the functioning, well-functioning Weberian states to emerge somehow. And I was thinking that a humanitarian organization working in conflicts, in civil wars, were quite good usually at working in so-called places of political hybridity, but obviously this is not yet the case as it should be, and I think the example that Andrea Bindo just brought to us is quite revealing. So thank you very much. We are all invited now to the cafeteria for a sandwich. For those of you who have some time, you can continue the discussion informally, and I would like you to join me in applauding our panelists.